What the color of your urine says about your health. It might not be a usual topic of discussion, but believe it or not, the color of your pee can reveal quite a lot about what's happening inside your body. Your body uses the color of your urine as a secret communication method that tells you whether something's right or wrong with your health. Trust me, you don't want to miss this message, so watch this video until the end and you'll be amazed at how this filthy and smelly liquid can be helpful to our health. Please note that the information provided in this video is for educational purposes only and should not substitute for professional medical advice. Always consult a healthcare provider for personalized guidance regarding your health. Number 1. Clear and pale yellow urine. First up, let's talk about clear and pale yellow urine. You see, when your urine is almost clear or has a light lemonade-like color, it's usually a good sign. It means you're drinking a good amount of water and your body is functioning just the way it should. So keep drinking lots of water every day and stay hydrated. Your kidneys are like the body's filtration system. When they operate smoothly, your urine should be relatively transparent. This pale yellow color indicates that your kidneys are efficiently flushing out waste products and you're adequately hydrated. It's like a little pat on the back from your body as an appreciation for taking good care of it. Maintaining this light shade of yellow should be your goal when it comes to urine color. It's a straightforward and reliable way to gauge your hydration status. You can say that it's a daily health check that you can do at home anytime. If your urine consistently looks like this, it's a thumbs up from your body. But of course, clear and pale yellow isn't the only color you'll see. Now we're going to talk about what dark yellow urine says about your health. Number 2. Dark yellow urine. If your pee leans toward amber or dark yellow, it's a gentle reminder from your body to drink more water. Dehydration might be creeping in, so make sure to increase your water intake. It's an easy fix to get your urine back to that ideal pale yellow. Dark yellow urine is your body's way of saying, hey, I need more fluids. When you're not drinking enough water, your urine turns dark yellow due to high concentration. This means that the waste products your kidneys are filtering out become more concentrated too, resulting in a darker color. So whenever you notice that your urine is dark yellow, instead of panicking, just increase your water intake and everything's gonna be fine. Think of urine as a barometer for your hydration. When it's on the darker side, it's like your body's way of saying, hey, let's do something about this thirst. It's a nudge in the right direction, reminding you to keep those water bottles handy and stay adequately hydrated. Number 3. Orange urine. Ever seen orange urine in the toilet bowl? Don't panic. It's not always something to be worried about. Some foods or medicines can make your urine turn its color into somewhat orange. It could indicate a liver or bile duct issue, but don't worry, it's a very rare case. Seeing orange urine can be very surprising, but before you reach a conclusion or something, think about what you've been recently eating. Foods like beets, carrots, and blackberries can sometimes change the color of your urine into somewhat orange or reddish. Even some medicines like some antibiotics or laxatives can produce this effect. If you're sure it's not related to your diet or medication, maybe the problem is somewhere else. Orange urine can be a sign of liver or bile duct problems. These issues can disrupt the usual flow of bile and lead to the presence of bilirubin in your urine, which can turn it orange. While this is quite a rare case, it's important to consult a doctor if you suspect any issues related to your liver or bile duct, especially if the orange color doesn't go away. Number 4. Pink or red urine. If you notice these colors, it might be due to foods like beets or some medicines. But if it's not related to your diet and doesn't go away, you need to see your doctor. Red urine can be a sign of blood in your urinary tract, which needs immediate medical attention. Seeing pink or red urine can be a bit alarming, but please do not panic. Beets are a common culprit for turning urine pink or reddish. Even some medicines like antipsychotic drugs or laxatives can cause this change in color. Pink or red urine can sometimes indicate the presence of blood, a condition called hematuria. This blood can come from sources like kidneys, bladder, or urinary tract. While it might not always require instant attention from you, it's important to talk to your doctor to check it out and determine the reason for the blood in your urine. Number 5. Green or blue urine? Yes, it's a thing. Don't worry, you're not turning into a smurf. This unusual color might be from food, dyes, or medications. It's usually harmless, but if it's causing you anxiety or any issue, it's a good idea to talk to your doctor. Seeing green or blue urine can be quite the shocker, but it's usually not as sinister as it might seem. In many cases, this unusual color is a result of something you've ingested, like foods with artificial colors or certain medications. Food dyes used in candies or sports drinks, for example, can sometimes pass through your system and temporarily tint your urine green or blue. Medications used to treat conditions like urinary tract infections or mood disorders can also be responsible for this colorful change. The key here is that it's often temporary and harmless. However, if you keep on seeing the green and blue color without any dietary or medication-related reasons, again, talk to your doctor. This is also rare, but there can be some medical conditions that lead to these unusual urine colors. So it's better to be safe than sorry, right? Number 6. Brown urine. Next up, we've got brown urine. Now this is a problem. Brown urine can be a sign of liver or kidney issues or even muscle injury. If you notice this color, it's time for a visit to the doctor's office to rule out any serious concerns. Brown urine is a bit more concerning than some of the other colors we've discussed. While it can have harmless causes like certain foods or medications, it can also be an indicator of more serious issues. Don't ignore it. One common reason for brown urine is rhabdomyolysis, which happens when muscle tissue breaks down and releases a protein called myoglobin into your blood. This can happen due to muscle injuries, extreme exercise, or other medical conditions. When myoglobin is filtered out by the kidneys, it can turn your urine brown. Another potential cause of brown urine is liver or kidney problems. These guys filter waste from your blood, so if they're not functioning properly, it can lead to unusual urine colors. So if you see brown urine and it's not related to something you've recently eaten or a medication you're taking, it's time to pay a visit to your doctor. Number 7. Cloudy or murky urine. If your urine looks cloudy, it could be a sign of a urinary tract infection or kidney stones. These are things you want to address sooner than later, so don't hesitate to reach out to a healthcare professional. Cloudy or murky urine can be a visual indicator that something isn't quite right in your urinary system. While it's not always a cause for panic, it's a signal that should prompt further investigation, especially if it's persistent. One common cause of cloudy urine is a urinary tract infection or UTI. It occurs when bacteria enter your urinary system and cause an infection. Along with cloudy urine, UTIs can come with symptoms like frequent urination, a burning sensation when you pee, and lower abdominal discomfort. If you suspect a UTI, it's crucial to seek medical attention promptly because untreated UTIs can lead to more severe complications. Another potential cause of cloudy urine is the presence of kidney stones. These small, hard deposits can form in your kidneys and sometimes cause discomfort or pain. When kidney stones move into your urinary tract, they can make your urine appear cloudy and might even lead to blood in your urine. So if you experience symptoms like severe lower back pain or pain while urinating, it's essential to consult a healthcare provider to diagnose and resolve your kidney stone problems. Number 8. Foamy urine. A little bit of foam now and then is no big deal, but if it's happening consistently, it might indicate excess protein in your urine. This can be a sign of kidney problems, so it's crucial to get it checked out. Foamy urine might not be a common topic of conversation, but it's worth paying attention to, especially if it occurs consistently. While a bit of foam in your urine from time to time is usually nothing to worry about, persistent foamy urine can indicate an underlying issue. One of the primary concerns associated with foamy urine is the presence of excess protein, a condition known as proteinuria. Your kidneys are responsible for filtering waste products from your bloodstream, and they should keep important proteins in your body. When the kidneys aren't functioning correctly, they can allow too much protein to escape into your urine, creating foam. Proteinuria can be a sign of various kidney problems, so if you notice persistent foamy urine, it's essential to consult a healthcare provider for a proper evaluation. They can perform tests to find the cause and recommend appropriate treatment if necessary. The color of your urine can be a helpful indicator of your health. Remember, while these colors are generally true, there can be exceptions. If you're never in doubt or notice a prolonged change in urine color, it's best to consult a healthcare professional. Your body is pretty good at giving you hints about what's going on inside, so pay attention. If you found this video helpful, don't forget to give it a thumbs up and share it with your friends. And of course, subscribe to our channel to learn more about health and wellness. Until next time, take care of yourself, stay hydrated, and keep checking the color of your urine to detect issues yourself. See you next time with another exciting topic.